This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch WisconsinEye on Spectrum Channels 995 and 363 and at wiseye.org.
Good afternoon, and thank you for joining us. This briefing is being carried on YouTube, and the audio is available on WisconsinEye. Before opening remarks and your questions, a reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone when it's time to ask your questions. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary-Designee Andrea Palm, Department of Veterans Affairs Secretary Mary Kolar, and available to answer questions, Dr. Ryan Westergaard, a Chief Medical Officer with the DHS Bureau of Communicable Disease, and Ryan Nilsestun, the Chief Legal Counsel for the Governor's Office. We will begin the briefing with remarks from Governor Tony Evers.
Good afternoon, and thank you for joining us today. I'd like to begin, as always, by thanking all of you for doing your part to prevent the spread of COVID-19. I've said it before, say it again, we've got to work together to flatten the curve and to stop the spread of this virus. Wisconsinites are tough. We're resilient. We help each other in times of need. And folks, we're going to continue to need your help. The number of Wisconsinites infected with COVID-19 is expected to continue to increase in the coming weeks. This increase in cases is also expected to bring a surge of patients who need to be treated by hospitals and healthcare clinics. Wisconsin's dedicated healthcare professionals have been working tirelessly on the front lines of this pandemic for more than a month now. But the surge will be with acute cases that is projected to hit our healthcare systems, and it's going to require more of us to step up in support of these ongoing efforts related to the COVID-19 crisis. Our top priority is to make sure there are enough resources to care for the growing number of people who who require hospitalization or other healthcare interventions because of this pandemic. That's why I encourage you to help our healthcare systems in this coming time of need by signing up to volunteer through the Wisconsin Emergency Assistance Volunteer Registry. Through this registry, we are creating a wide network of volunteers to increase capacity at hospitals and clinics across Wisconsin. Help is needed in both clinical and non-clinical support roles. However, we especially need licensed professionals to volunteer for critical clinical roles. These include physicians, physician assistants, nurses, nurse practitioners, certified nursing assistants, social workers, pharmacists, pharmacy technicians, physical therapists, physical therapy assistants, respiratory therapists, and behavioral health professionals. Our effort to build this volunteer network is one of the many proactive measures that we are taking to plan for that surge of acute cases that are projected to hit our healthcare systems in the coming weeks. We've already made a number of changes that help grow and strengthen our healthcare workforce, such as expanding telehealth services, making it easier for retired healthcare workers to rejoin the workforce, and allowing out-of-state healthcare professionals to practice in Wisconsin. These efforts have helped, but as we prepare for a surge of cases in the coming weeks, we still need more folks to help. Volunteers will play a critical role in ensuring that we have the resources and flexibility to respond to our state and local needs. I urge you, if you can, please sign up to volunteer for these critical roles. In addition to needing additional capacity in our healthcare workforce, we're going to need additional space to treat folks as the number of acute cases continues to rise. Our team at the State Emergency Operations Center has been hard at work over the past few weeks to prepare for this surge. Yesterday, I announced that the Army Corps of Engineers has officially been engaged and has already begun mobilizing at the Exposition Center at the Wisconsin State Fair Park to begin development of an alternative care facility, or ACF. We are extremely appreciative of FEMA and the Army Corps of Engineers for their responsiveness as we continue to see an increase in the number of individuals testing positive for COVID-19 in Wisconsin. This alternative care facility will be a critical addition to the southeastern part of our state and will be essential to continuing to ensure our healthcare systems are not overwhelmed. I also want to thank and give my sincere gratitude to the Wisconsin State Fair Park leadership. Their willingness to open their doors to support the region's residents during what may be these folks' darkest hours is exactly the kind of leadership that illustrates how Wisconsin's best are stepping up and in response to COVID-19. Another way that we're being proactive is around contact tracing. Once someone has confirmed COVID-19 diagnosis, it is extremely important to find out where they have been, who they have been in contact with, so that we can try to further contain the spread of the virus. Over the course of the last few weeks, DHS has added more than 120 contact tracers to aid local public health departments who need additional capacity. Contact tracing staff have worked to follow up on more than 1,000 interviews to identify and notify contacts for the Milwaukee Health Department alone. Additionally, the legislative package that I propose and that I have been urging the legislature to take up as soon as possible includes $17 million in new funds for local public health agencies and 64 additional staff at DHS to adequately respond to our public health needs in Wisconsin. These proposed contact tracing assets will be critical to Wisconsin's ability to actively manage this pandemic until effective medical treatment or a vaccine is available. DHS is also working with local health departments across Wisconsin to effectively track individuals who may have been exposed to COVID-19 during Tuesday's election. I was impressed by the efforts taken by local clerks, poll workers, and our National Guard members and the voters themselves to keep each other as safe as possible, but we must be prepared. Part of that preparation is increased capacity in contact tracing Make it impossible for anyone who tests positive to be interviewed about their contacts, and then notify any individuals who may have been exposed to COVID-19. Because people who may have contracted COVID-19 this week may not begin to show symptoms for a week or more. It will be incredibly important for us to continue to closely monitor and trace contacts for these cases. It just goes to show that COVID-19 public health emergency really has affected all of us in so many ways. We are holding staff meetings in the living room and geometry class at the dining room table. We can't go out to get a haircut and we're feeling cooped up at home. COVID-19 is changing where and how we do things, almost everything, and we have all had to adapt quickly. So before I hand this over to Secretary Palm, I want to say thank you so much again to all of our critical workers who are on the front lines working to provide health care, keep our grocery stores open, clean and stocked, farm our lands, and ensure our infrastructure is maintained. In this time of safer at home, it is extremely important that we continue to respect all our residents and workers of this state, no matter who you are, where you live, or what you believe. Kindness and understanding is how we will get through this. The last thing we need right now is stigmatizing or calling out any group of people, and especially those who have contracted COVID-19. This illness is what we're up against, not against each other. Each one of us has a very important role to play in keeping us all safe, caring for one another, and using this challenge to bring out our best humanity. So thank you, and I'll now turn it over to Secretary-Designee Andrea Palm. Andrea?
Thank you, Governor. Good afternoon, everyone, and thanks for joining us again today. The COVID-19 pandemic is challenging all of us, and I see evidence of Wisconsin rising to meet that challenge every single day. Our neighbors volunteering with Meals on Wheels or packaging food to be delivered from food banks. Grandkids reaching out to nursing home residents with music concerts over their speakerphone. Restaurants donating food to hospital staff, and manufacturers participating in the governor's PPE donation and buyback program. And now that the governor has put out this call for volunteers to help staff hospitals and clinics across our state, I know this will be one more way that Wisconsin rises to the challenge of COVID-19. The first step in confronting a challenge, in trying to fix a difficult problem, is understanding it. This means digging into the data and continuing to be transparent, which is why we have added data on COVID-19 cases and deaths broken down by race and ethnicity. Consistent with what other parts of the country are seeing, these numbers show us that the pandemic is disproportionately affecting the African American community in Wisconsin. To be clear, COVID-19 can infect any individual, and at the same time, it also has a more significant effect on communities that have been underserved by inequitable access to health care. COVID-19 is making more visible the health disparities that already exist in our state, and we must work to end these disparities. This will be long-term work for us at DHS, but we are committed to doing this work so that every Wisconsinite has an opportunity to thrive. Our partners at the Department of Workforce Development are also working to assist Wisconsinites who have applied for unemployment insurance benefits. In the last 3 weeks, DWD has seen 296,000 initial unemployment claims. Unemployment can also result in a loss of health insurance. However, just like you are eligible to apply for unemployment after a job loss, the loss of employer-based health insurance means you are eligible to apply for health insurance elsewhere. Depending on your income, you may be eligible for Badger Care, and you can find more information on that state insurance program and its eligibility requirements at access.wisconsin.gov. If you're not eligible for Badger Care, you have a 60-day window from your job loss to enroll in a new health insurance plan through healthcare.gov. You can get free help to explore your options by calling 211 or connecting with an enrollment assister at coveringwi.org. I encourage you to look into your options because taking care of your health is more important than ever. Another challenge facing many Wisconsinites is access to affordable food. Through funding from the federal Families First Coronavirus Response Act, we are going to be able to help with that. Any food share household in Wisconsin not currently at the maximum benefit for their family size will see an increase in their benefits. These increases will be available to 215,000 food share households on their Quest cards on April 12th and then again on April 26th. DHS also continues to track cases in Wisconsin, and so here is our update on where we stand today. We have 20 active labs that are running COVID-19 tests in Wisconsin with a daily lab capacity of 3,756 tests. In fact, we have more capacity for testing than the number of tests done by providers. To address this, we've expanded our testing guidance and will continue to communicate with providers to further expand testing. We have 33,225 negative tests, which is an increase of 1,801 negative results over yesterday. We have one county reporting a case for the first time, and that's Polk County. We now have 3,068 confirmed cases in the state of Wisconsin, which is an increase of 183 Wisconsinites over yesterday. Our number of COVID-19 hospitalizations is 904, which is an increase of 61 over yesterday. This means that 29% of people who have tested positive for COVID-19 in Wisconsin have been hospitalized. Our total deaths have now reached 128, with 2 counties reporting deaths for the first time. Those are Brown and Grant counties. This is a challenging time in Wisconsin and across our country, and we do honor the memories of all those who have passed on, and we grieve for those of you who are experiencing this loss. But I know Wisconsin will continue to rise to the challenge and stay safer at home. We will continue to practice physical distancing to flatten the curve, and we will continue to support each other to reach out and connect in creative ways. Thank you all for what you are doing to keep yourselves and all of Wisconsin healthy and safe. From Secretary Mary Kolar of the Wisconsin Veterans Affairs.
Okay, thank you, Governor Evers and Secretary-Designee Palm. Thank you for the opportunity to update everyone on particularly our veterans' homes. I greatly appreciate the entire DHS team and their hard work and expertise and guidance as we do all we can to prevent the spread of COVID-19. And I especially thank the governor for his leadership during this challenging time. Again, an update on our COVID-19 activities at our Wisconsin veterans' homes and throughout the Wisconsin Department of Veterans Affairs. Providing a safe and healthy environment for our veterans and the residents who live at our homes and our staff is our top priority. As Secretary of the Wisconsin Department of Veterans Affairs, I'm responsible for overseeing various veterans programs and services throughout the state. Overseeing the state's 3 24-hour skilled nursing facilities for veterans and their families is foremost among them. You may have a family member residing at one of our homes. We are responsible for the care and safety of about 680 veterans and nearly 1,000 staff, including medical professionals, at our homes located in Chippewa Falls, King, and Union Grove. At this time, we have no cases of COVID-19 at our Wisconsin veterans' homes. This includes both staff and members. We continue to follow the recommendations of the Centers for Disease Control and the Wisconsin Department of Health Services and carry out our normal protocols to help prevent the spread of the disease. Over the past few weeks, we have taken several steps to help prevent the spread of COVID-19 in the Wisconsin veterans' homes, including restricting visitors and volunteers from visiting facilities, except in end-of-life situations, actively screening every single person who is entering our facilities, including staff, for COVID-19 symptoms. The screening includes a temperature check. Daily screening all members for COVID-19 symptoms. Canceled all large group activities and communal dining and focused on smaller unit and individual activities. Educating all members and staff to practice social distancing. Renewed emphasis on routine environmental cleaning. And we have stopped drop-off donations, but there is one exception to this donations rule. With the most recent guidance of the Center for Disease Control, we are now accepting donations of handmade cotton masks for use by those who live in our homes. The CDC has said that residents need to cover their mouth and nose when staff are in their rooms, and we believe cotton masks will help make that easier for them. Please do not mistake this as a request for personal protective equipment, or PPE, such as N95 masks, as we currently have PPE available for staff. When it comes to PPE, we are following CDC recommendations, learning from what has happened in other states, and have the appropriate measures in place to request more in the case of an outbreak. Also know that when we do receive homemade cotton masks, we will be taking the appropriate steps to sanitize them before we give them to our residents. Before I conclude, I'd like to briefly touch on two other items that may be helpful to you and the veterans who you may know. First, if you're looking for information about any of our programs, benefits, or services, the staff at our Veterans Benefits and Resource Center can help. As we follow Safer at Home guidelines, you can reach a customer service representative through the online Chat Now feature located in the bottom corner of the screen at www.wisvets.com. We also encourage use of www.mywisvets.com for learning about eligibility for Wisconsin veterans benefits. Second, if you are a veteran in need or you know a veteran who's experiencing housing, substance use, or mental health issues, we want you to know that there are many resources available to you or them. We understand this is a really tough time for everyone, but particularly those with underlying mental health issues. If you go to the WDVA website, wisvets.com, and click on the COVID-19 link, you will find a broad array of resources available to help. Please, if you need it, utilize the Federal VA's crisis hotline, 1-800-273-8255. Other resources include Vets for Warriors, who provides 24/7 confidential peer support to any veteran, service member, or family member. Military One Source stands ready to assist military members. Anyone can call 211 and get connected to local services. Each and every one of us can help by calling, sending a text, or an email, and perform what we call in the military a buddy check for a friend who may be struggling. The WDVA also has staff standing by who can help. Our Veterans Outreach and Recovery Program coordinators are located throughout the state and are able to connect veterans with community resources such as mental health services, emergency shelter, food and housing assistance, access to health care, financial assistance, and more. We can then provide the case management that veterans need to move forward in a healthy way. The VORP coordinator's contact information is on our website, or you can simply use the Chat Now feature I mentioned, and our customer service reps will put you in contact with the right person. Wisconsin has a strong veterans community of which I am proud to be a part. I know that we all will continue to work together and support one another as we get through this challenging time. Thank you.
Thank you. We'll now open it up for questions. A reminder to maintain audio quality, to keep your phones on mute until it's time to ask your question. And in the interest of time, please one question per reporter per media outlet. And we'll begin today with Scott Bauer from the Associated Press. Scott?
Hi. Thank you, everyone, for doing this call. A two-part question. One, Governor, could you react to the Republicans saying they're coming in next week to take up COVID legislation? Have you agreed to what they're proposing or seen it? And two, related to that, Secretary Palm, Republican senators today, two senators have accused you and the department of stoking fear, and they claim that lawmakers were told the stay-at-home order may be extended for 6 months. Could you react to those comments as well?
And I'll just begin about the legislation, and we continue to have conversations with legislators, and we're hopeful that next week we'll see a bipartisan solution that helps us kind of bridge the gaps that are existing in the federal legislation. So I'm looking forward to it. I haven't seen the details of what they're proposing. And it's always important to wait for the bills to be put out there so we can actually see and react to it. But I'm hopeful, and hopefully we will reach a good conclusion.
So, Scott, this is Andrea. I would say since the beginning of this outbreak, we have worked to be as transparent as we can about the facts on the ground here in Wisconsin. And so our goal is to make sure that Wisconsinites understand the outbreak here in context with what's going on around the country and around the world, so that we can make the best decisions and work together to protect the people of this state. As it relates to the safer at home order, I think, until we have a vaccine, until we have medical intervention, we are going, as the governor said, to have to very actively manage this outbreak. And Safer at Home is the current tool that we are using. We used a variety of tools before we got to Safer at Home. We assume we will use a variety of tools as we manage this in a more active way with moving forward. I certainly have not put a specific time frame on when we would pull back from Safer at Home, because as we have said every day in this media briefing, we are following our data very closely. We are trying to understand what it means for the extent to which we are flattening the curve. We are looking at other parts of the country and other places around the world to understand how they have managed, how they have altered their interventions as their peaks have happened, as their surges have happened, as they have moved through this outbreak, so that we can make the best decisions in a real-time way to help protect the people of this state.
Thank you, Scott. Now to Maddie Heim from the Appleton Post-Crescent. Maddie?
Hi, thanks for taking my call. I just want to go back to the governor's decision that had been talked about a couple weeks ago to buy 10,000 ventilators. And I'm just wondering if we could get an update on how that's going, where we are in that process, and also how that 10,000 number was decided upon specifically.
This is Andrea. I'm happy to take that. I think it's important for folks to know that this was the 10,000 was our portion of a multi-state effort to buy ventilators, which fell through. So we do not have 10,000 ventilators currently on order, but we have very actively been pursuing other opportunities to purchase ventilators, and most recently have been working with a company to purchase around 1,500 ventilators in anticipation of continuing to need to have access to these kinds of medical supplies. As we have discussed throughout this outbreak, our goal is to plan for the worst and do everything we can to prevent that from happening. And so we do continue to look for needed medical supplies for PPE. We do continue to plan for potential surge and are working on surge capacity with local jurisdictions around the state. We've stood up isolation facilities. We are bulking up our contact tracing and our testing capabilities. But again, our goal is to be ready for anything and do our very best to make sure it doesn't happen.
Thank you, Maddie. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly? Molly Beck?
Sorry about that. Thanks for taking this call. Governor, two Republican senators are suggesting in statements today that it's unfair that public employees haven't been subject to pay cuts as private workers have and also experienced layoffs. Is that something that you would consider doing to help the state's finances?
I'm sorry, the question is, I mean, we have people, almost all state employees are working. If they work, we expect that they'll be paid. It's a pretty simple proposition.
Thanks, Molly. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell? Mitchell Schmidt?
Yeah, can you hear me? Yep. Thank you very much for the call. I appreciate it. I know this has been touched on a little bit, but obviously there's kind of two different main issues that we seem to be hearing a lot, and that's the public health concerns, and now we're getting a lot of comments about the economic concerns. I was wondering if just maybe for the governor, if you could talk a little bit about kind of what's kind of going through your mindset when you're balancing these two issues kind of at the same time.
Yeah, and of course we need to recognize that everybody wants to return to the way it was a year ago from now, or last year when there wasn't a virus. And so we continue to use science to make sure that we're making the right decisions, and we'll continue to do that. That does not mean, though, that we're ignoring the issue of people being unemployed, businesses not in operation, although we do have a significant number of essential businesses in the state that are continuing to do the great job they are doing for the people of Wisconsin to make sure that this virus and this epidemic is eventually thwarted. But at the end of the day, we do have to follow the science. We clearly, as we get closer to a point where we feel comfortable relaxing some of the requirements, we will, and we'll be working with the business community to make that happen. But it's not an either-or situation when it comes to people's lives. We have to use that barometer first.
Thank you, Mitchell. Now to Brianna Riley from the Cap Times. Brianna? Brianna Riley?
This is Parker Shore. I'm going to ask her question on her behalf. She was wondering if you know when the bill draft will be released, Governor Evers.
I personally don't at this point in time know. Are you referring to the Republican? The Republicans coming into session? It doesn't make any difference. I don't have that. I don't have that information now. All I can tell you is that we'll be working with the Republicans to reach a conclusion that's in the best interest of the people of Wisconsin. Now, I just want to cycle back and follow up a little bit more. I gave a pretty short answer about state employees. Yes, if they're working, they're getting paid. But I will tell you the tens of thousands of state employees that are doing work for the people of Wisconsin are doing essential work. Whether it's unemployment insurance, whether it's making sure that our correctional institutions are functioning at a high level, to make sure that some of our most fragile Wisconsinites who are in our institutions are being taken care of, and the care is of the top, the most important quality. So to suggest that somehow state employees are not valued, and I don't know if that was the point that was being made in an earlier question. I value them, and the people of Wisconsin value them. They're providing important services. You heard the Secretary of the Department of Veterans Affairs. If all those people are laid off, there would be no services for our veterans in the state. So come on, folks. The rhetoric around this topic is escalating in a direction that I think is not helpful. And hopefully we can continue to defeat the virus instead of trying to defeat each other.
Now to Dylan Brogan from Isthmus. Dylan?
Thank you very much. Governor and perhaps Secretary Palm, were lawmakers, Republican or otherwise, told that the safer at home order could last 6 months?
I'm sorry, did you ask, were they told that?
Yeah, that's what they are telling the press.
I have never had a conversation with them in which I said that the safer at home order would last 6 months. I'm sure what I said is that absent a vaccine or other effective medical intervention, we are going to continue to have to manage this epidemic. And considering where we are in the stage of clinical trials, that certainly is at least 6 months away. I think that we need to understand that until we can medically treat this, the tools that we have are physical distancing and the kind of mass gathering restrictions and other things that we have done. But I certainly would not suggest that we want to stay in a position of safer at home for 6 months if we can do other things that are more surgical and less restrictive. But we need to follow the data. We need to follow the science. We need to make sure that we are looking at all of the context around this to make the right decisions to keep the people of this state safe.
Thank you, Dylan. Now to Emily Fannin from WKOW in Madison. Emily?
Secretary Palm, this is a follow-up on the safer at home order. It was almost two weeks ago today that you said without this order, models predicted 22,000 positive cases and over 1,000 deaths. Since this is not the case yet, why not extend the stay-at-home order right now to prepare people?
So I think, I appreciate the question. I think just for clarification, 25 infections is different than the number of positive cases, right? Because we are not testing everybody who has symptoms or everybody who might be infected. Because of our capacity, because of the prioritization we have placed on healthcare workers, on those who are hospitalized, on the clinical piece of the testing regimen currently. We are expanding those criteria, but we have tested the tip of the iceberg, as Dr. Westergaard has said. And so I think it's important to remember that that 22,000 is infections, not positive cases, and that our goal was to do safer at home to prevent that from happening, to do everything we could for that not to be the case, because we didn't want to be in a position where we were straining our healthcare system with that kind of workload. And so I think what you're seeing in our curve, in our daily case counts, in the number of days it takes to double cases, is that safer at home is having an impact on our curve. We are doing good work to flatten the curve, and that's exactly what we wanted to do. It's exactly what we as a state need to do. And so we will continue to watch that data. We will continue to look at our model, the models that other people are doing, and make decisions based on the current state of our outbreak and the things we need to do moving forward to protect the people of this state and to build the underlying infrastructure that'll be necessary to allow us to actively manage this outbreak, which again are those testing tools and those contact tracing tools, as well as the surge and other pieces of the infrastructure that we have begun to stand up.
Thank you, Emily. Now to WISC in Madison. WISC? And a reminder to press *6 to mute and unmute your phones. WISC. Okay, moving on then to Caroline Peterson from NBC 15 in Madison. Caroline? Caroline Peterson? Okay, moving on then to Robert from Madison 365. Robert?
Hi, good afternoon. Thank you. My question is about the testing. I think I heard Secretary Palm say that you have more. Basically, you have more lab capacity than you have tests coming in from the field, and that you're changing the guidance on who gets tested. Can you talk a little bit more about that? Specifically, in what ways are you changing that guidance? And are there actually testing kits or whatever in the field right now that can be used once you relax those guidelines?
Do you want to talk a little about the guidelines, Dr. Westergaard?
Yeah, I'd be happy to. This is Ryan Westergaard. We've seen consistently for the past week or so that the number of test results that we receive every day is quite a bit lower than what we think is the maximum or the capacity that would be if all the labs were running as many tests as they could on an ongoing basis. So that tells us that we have more capacity than demand right now. So the guidance that we've shared that might be different is really that clinicians can not feel constrained in any way about ordering a test when they think it's beneficial for the patient. So there's clinical guidance from the CDC and general training that all healthcare providers say if they understand the clinical picture, or they do an evaluation, they think COVID-19 might be the diagnosis, they can feel free to order that test. Now, the tiers or the criteria that we've talked about in the past, we're not using those anymore. But one thing that's been required some additional communication is because at our 2 labs, 2 of the 20 labs that are doing tests are our public health labs. There's one in Madison and one in Milwaukee. They have an important role to play because they get public funds and they are serving the public health system and are the safety net labs. So we want to make sure that we use those tests wisely, and so we still prioritize healthcare workers, hospitalized patients, critically ill patients there. And so there are some criteria that allow us to prioritize those public health laboratories. But the capacity that we've built around that has now gotten to the point where there really should not be any restrictions. Any provider, if they feel like it's the best thing for their patient, can order a test and send it to one of these other labs.
Thank you, Robert. Now to Mel Meyer from WKBT in La Crosse. Mel?
Hi, yes. I'm wondering, and this is for the Wisconsin Department of Health Services, have providers been directed to keep track of the people who are calling the hotlines that they've perhaps set up, and are they required to share that with the state? And would it be prudent to keep track of these people with potential cases for a later date where they might be tested, or even have their blood plasma used at a later date?
Yeah, I'd be happy to talk about that, that as well. So we're using a really broad range of sources of data to understand how many people are developing symptoms and whether people present to an urgent care or an emergency department with symptoms in the various outpatient settings. We try to capture those data. The state has set up our own nurse triage line that people can call if they have concerns about things related to COVID-19. We're collecting the data about how many people call that with symptoms. And then we have ongoing ways of saying what percentage of hospitalizations and visits are due to a respiratory infection, for example. So we're trying to monitor the overall what we call syndromic surveillance, meaning the syndrome of respiratory infection that could be COVID-19 on a broad basis, and being able to see that really in real time. So that's giving us some indication of where things are headed.
Thank you, Mel. Now to Fox 11 in Green Bay. Ben Krumholtz.
Yeah, can you explain what uses you plan to have for the data showing who is infected through in-person voting?
I'm sorry, I missed the beginning of the question. What?
Yep, can you explain the uses for the data showing who is infected at the polls?
So I think our goal with all of our contact tracing, right, is to understand where somebody was, where they have been, and who they were in contact with, so that from that positive case, we know who else we need to notify, who else we need to interview, so that we can wrap around those potential exposures and prevent further spread and a larger outbreak. And so what you've seen, I've seen some press reports recently about parties and that happened previously, and how those turned out to be beds of spread, and you can trace it back to that mass gathering. And so from that perspective, that's what the polls were on Tuesday, was a version of a mass gathering. And so we, like all of our contact tracing, will work to figure out where it was that someone was exposed, who else might have been there, and be in touch with those folks as necessary to really wrap around and stop transmission as much as possible.
Thank you, Ben. Now to Casey Nelson from WTAQ in Green Bay. Casey?
Thanks for taking my call. Just maybe some thoughts about if we're still on schedule to reopen the states at the initial time that the safer home order is set to expire, and then maybe what that process would start to look like as we kind of reopen the state here.
Well, I'll give the view from my vantage point. Reopening a state, when that happens, it is unlikely that it's going to be, okay, today everybody's home, tomorrow everybody's going back to work. It just, there isn't a scenario that I can see that would allow that to happen. So we're always planning on that, but as I said, the science is what drives decision-making in this process, and science will determine what reopening looks like and when that will happen.
Thank you, Casey. Now to Addie Bink from WFRV in Green Bay. Addie?
Hi, yeah. So we recently saw the closure of 40 state parks and other areas earlier this week. What's keeping people from going to other state parks, for example, in Door County? They can't go to theirs this weekend. Well, why not just go to Door County? Won't that kind of impact the spread of the virus at all?
I'll just talk about it. I hear this issue a lot, and if I heard the question correctly, it's about people from other states coming to Wisconsin during this time, and frankly, vice versa. People in Wisconsin going to Minnesota, Michigan, Illinois. And that is a concern I hear a lot. Of course, we have things around, people have the right to move or to drive from one state to the other. And so there's nothing to prevent that from happening. I'm working with the other governors essentially to get the message out that when people go to another state, you're adding stress on the location you're going to. You're adding stress on an already stressed circumstance in an area of the state, whether it's out of state of Wisconsin or in Door County or other places. So we need to keep communicating that. I know some counties in the state of Wisconsin, at least one, I'd say a county, is preventing folks from bringing trailers into their county and parking them in places where people could live and live for a short period of time. Resources are scarce, especially in our least populated counties, and the last thing they need is to have those resources, be stretched even further than they are now. But at least from my vantage point, there's no way to prevent that from happening. We're just going to continue to encourage people to stay at home in their home state.
Thank you, Addie. Now to Cammie Rapsum from WBAY in Green Bay. Cammie?
Hi there. Secretary Palm and Governor Evers, is regarding the press release on contact tracers. Is there a genuine fear we will see outbreaks in the next 1 to 2 weeks related to that in-person voting? And Governor, do you hold out any hope that elections, the remaining elections in 2020, will go to a mail vote as some Democrats have proposed this week?
So I think what we know about this this disease is that close contact, mass gatherings are a vehicle for the spread of the disease. And so whether it was a polling location on Tuesday or some other form of mass gathering, there is a chance for the spread of the disease. We certainly were talking about that ahead of the election as well. So it is our hope that all of the really good preparation and work that our local clerks did, that the training that poll workers got, that the surge of plainclothes National Guards men and women, and the guidance that we provided to polling locations on physical distancing helped keep folks as safe as possible. But time will tell, right? The data will tell us what, if any, impact in-person voting on Tuesday had, and we will certainly be monitoring that. We will understand that better as the days and weeks go on, and we start to understand through contact tracing where folks might have been exposed to COVID-19.
I'll just speak to mail voting in general. I haven't seen the bill, so I'm reluctant to respond to it, but we had over 1 million people this last election take advantage of absentee balloting in the state. That tells me that there's a genuine interest in it, and clearly some of it was driven by the concern people had about going to the polls on the election day. But going forward, I believe that it will be part of Wisconsin's landscape, where people understand that it's easier and it's a good way. It's a good way to express and participate in democracy in a way that is reasonable, and there's good belief that it is a safe way to do that, and so I support it. But as far as the particular bills you're mentioning, I haven't seen them, so I'm not going to comment on that. But 1 million people thought it was an important way to communicate to its government this last week earlier this week. And so I think that's a statement in and of itself.
Thank you, Cammie. Now to Jonathan Neiser from NBC 26 in Green Bay. Jonathan?
Yes, we've been talking a lot about the lack of certain supplies and such, need for ventilators, need for tests, need for PPE, need for hospital beds, and need for medical professionals, doctors, nurses, etc. I know there's data out there, but can somebody point us to kind of what's the greatest need right now? Where are we hurting the most in order to meet the need?
So I would say from my vantage point, the medical supplies as it relates to PPE is probably one of our most important limiting factors right now, right? We need to protect our frontline healthcare workers from exposure to COVID-19, and their access to appropriate PPE is a fundamental part of how we do that, right? We also need access to the kind of PPE in long-term care and other congregate living settings where vulnerable people live and where their caretakers need to be protected from exposure. And so that would be a place where I think we have the greatest need. And it impacts the other parts of the system. It impacts our ability to expand testing, because you need to wear PPE when you are administering a COVID-19 test. And so all of these pieces fit together in ways that make it really important for us to continue to get our hands on needed medical supplies, but particularly PPE. It's why the governor stood up the buyback and donation program. It's why it has been a focus and a task team, a strike team within the SEOC work, and it is why our procurement folks are working so hard to vet vendors and understand who's legit and who we can really trust to deliver these kinds of supplies to us outside of the avenues that we have had through the Strategic National Stockpile and through FEMA.
Thank you, John. Now to either Victor or Mark from CBS 58. CBS 58 in Milwaukee.
Hi, this is Victor with 58. Thank you again for taking the call. One population that is one of the more vulnerable ones and ones that the administration has already taken action on is the prison population. And there are still continuing concerns with that, with a lawsuit coming today from the ACLU. I was wondering if, one, there's a response to that lawsuit, and two, is with this risk of further exposure for this population, is there further action that DHS or the administration is looking at doing for the prison population?
Sure, I'd be happy to answer that question. This is Brian Nelson-Stewin. We'll be responding to the lawsuit, just as we do to every lawsuit. That said, we're confident that we're taking every reasonable and practical step that we can to minimize the risk of COVID-19 to our prison system. And, as you mentioned, this is an important issue. There are 24,000 people who are incarcerated in the Wisconsin's prison system. It also impacts the 12,000 correctional officers that we have in this state and all of the people that those correctional officers interact with. And that's not to mention all of the people who work in our jails or who are incarcerated in our jails, county jails. And so it's something that we've been focused on from the very beginning of the COVID-19 pandemic. And we've taken a lot of steps in order to minimize the risk to people who are incarcerated and to the people who every day work in our correctional institutions. And just to name a few of those actions, we've worked to restrict who gets admitted to the prison system. We've worked to reduce the number of people being admitted by lowering the number of crimeless revocations, so we don't have as many people in our prison system. Department of Corrections has set up screening of all employees who show up to make sure that they don't have any symptoms of COVID-19 and that their temperature is being checked. The Department of Corrections has detailed isolation and separation procedures in place at all 42 institutions. And we've also worked very closely with DHS and the National Guard to make sure that the Guard is ready to go into an institution if we have a large number of correctional officers who are sick, but then also to make sure that each institution is implementing best practices. So I think it's not to say that we've won the battle by any means, because it is a very vulnerable population, and there are high risks with that. That said, I think we've done a lot of good work in order to keep the number of people who do have COVID-19 who are either incarcerated or work in the correctional institutions has been able to be kept to a fairly small number to date.
Thank you. Now to Casey Cronus from Fox 6 in Milwaukee. Casey?
Hi, thank you. It was mentioned earlier that more contact tracers have been added. I'm just wondering, what might someone expect if they are contacted by one of these tracers and is told that they have come into contact with someone who's tested COVID positive? Would that person then be on their own to monitor symptoms, or is there some sort of database that they're added to, and do contact tracers then follow up with that person?
Those are great questions. I'm happy to talk through that process a little bit. So this is a time-honored public health activity that is done for a large number of communicable diseases. And how it usually works is that when someone is diagnosed with a reportable condition, they get either a telephone-based or an in-person interview where they start by trying to establish trust and educating the patient about what they need to know about their condition, but also talking about ways in which they may have exposed other people to the infection depending on how the particular infection is spread. So in this case, they would go through a detailed follow-back, a timeline follow-back to see who the people that you've been in close contact with, your household contacts, times we've been within 6 feet, and then in as sensitive and confidential a way as possible, people who were contacted will be notified by public health and saying that it's been identified you may have been in contact with someone, and they'll in a very individualized way tell them what they need to know. And if they meet the definition of a high risk or a contact that requires quarantine, they'll tell them what that means and what they need to do about symptom monitoring. And we've developed informational materials, and we have good handouts in education to tell people what it means to be in contact and what it means to monitor symptoms. And we have an electronic database that we use for this. People can actually do a daily symptom check and check in by emailing the WEDS system, and so they can be sort of monitored that way. And then the important thing is that if someone is in that exposure period, if they develop symptoms, then there's a possibility, or in some cases it's a probability, that they are going to be counted as a case. So they need to know then who to contact, whether it be their primary medical provider initially, or public health, to say, I'm starting to have symptoms, what should I do? And then we make the determination of, is that someone who's in the exposure window where they would be considered a probable case, and then whether they get tested. So it's really the local public health that is very qualified to do all of these. In this extraordinary situation, the number of cases is in many cases outstripping how well local public health can do it, or not how well they can do it, but how frequently they can do it. So the resources that we've been trying to use to support at the state level have been to try to take off some of that burden in a coordinated way and have other people who do those contact tracing interviews. And this is going to be something that is a hallmark of our response in the next coming months to a year, until we have a vaccine or some semblance of herd immunity where it's not circulating in the community. Our goal is that every person who is diagnosed with COVID-19 and any probable case goes through this. And we really want the public to realize that they need to support this activities, because this is how we understand where the infection is and how we isolate it. So this is really this is sort of democratic public health in action. Everyone needs to understand that this is a critical piece of how we manage communicable diseases, is sharing this information and working together to make sure that we know where the infection has spread and what resources we need to try to contain it when that happens.
Thank you, Casey. Now to Rachel Glass from TMJ4.
Hello. You said the number of hospitalizations increased by 61 from yesterday. How much of that was in Milwaukee County? And if this trend continues, when do you predict the alternative care facility will be needed at State Fair Park?
So I actually don't have right in front of me the breakdown on the 61, so we can follow up with you on that. I will say that we have we have added some information on hospitalizations, ICU, and vent use regionally today to the website, so you should be able to dig in a little bit there and understand on a regional basis what that looks like. But we're also happy to follow up with you.
Thank you, Rachel. Now to Matthew from WISN in Milwaukee. Matthew Sin.
Hello, Governor. Dozens of business groups and chambers of commerce wrote you a letter asking to reopen after April 24th and to use that as a target date. What is going to be your answer to them about using April 24th as a target date to reopen?
That we're sound like a broken record. I appreciate their concern. Nobody wants to open up the state any more than I do. But we have to make sure that the state is ready to be opened up in what situation. So we are working hard on those plans to when we begin to reverse some of the restrictions we have put in place. But we will follow the science, and right now the curve is not bent, and we need to make sure that we're headed in the right direction. I think whether you're a business leader or you're not a business leader, you're just, Tony Evers sitting at home, last thing you want is to have a resurgence because you, quote unquote, reopened too soon. And so, as governor, I feel it's important that we continue to follow the science, but we will, obviously, we're in the process of thinking about how that will look going forward, and we'll keep people posted.
Thank you, Matthew. Now to Jeff Arnold from The Patch. Jeff? And a reminder, *6 to unmute your phone. Jeff Arnold from The Patch. Okay, we'll move on then to Ben Meyer from WXPR Radio in Rhinelander. Ben?
Hi, good afternoon. This question is for Governor Evers. Governor, my understanding is, unlike for Tuesday's election, you personally may have the power to change the date of the special election here in the 7th Congressional District, which is scheduled for May 12th by virtue of it being a special election. Of course, that's a month away. Can I ask, are you considering changing the date for the congressional special election here in northern Wisconsin?
I'll be happy to answer that question for the governor. So this is Brian Nelson. It is something that we're taking a close look at, and as the governor has said before, it's going to be following the science. So we are taking a look to see where the number of cases are in terms of the 7th Congressional District. It is, as you know, an especially large congressional district. It impacts a lot of municipalities, so it's going to be a decision that is based on the science. It's going to be a decision based on working with the clerks in the 7th Congressional District to make sure that any change can be implemented in an orderly manner that is both consistent with the science but also causes the least amount of disruption.
Thank you, Ben.
The governor does indeed have that power in this case?
We've already changed the date once.
Okay.
Moving on to Matthew Piper from the Sheboygan Press. Matthew?
Yeah, do I understand right that, for Dr. Westergaard, do I understand right that healthcare providers may be under a mistaken assumption that tests for their patients aren't available? If so, why would that be? And what about your experience makes you think that it's that and not that there's a lack of people needing tests or a lack of swabs or something else?
Right. So I think the second possibility that you mentioned, that there's not a demand because there are not that many sick people, is definitely a possibility. When we've looked at the syndromic surveillance that I referred to earlier, the total number of outpatient visits for any reason are down in the state. The number of respiratory visits to outpatient clinics are also down. So it's certainly possible that there's not a lot of tests needing to be done that are going undone. It's just that we've not, we're controlling the level of respiratory illness at a low level, and not many more people need it. So that is totally possible, and I frankly hope that that's the case. We're not seeing a great number of a large number of undiagnosed infection. The question about is it related to shortages in swabs and other materials, we know those things are issues. We try to keep track of them. The state lab has been doing surveys of other laboratories around the state to say what shortages exist. And what we're learning is that there's concern about various ingredients being in shortage, but right now there are very few labs that are saying that it's substantially slowing down the number of tests that they're able to do. So I think it's a little bit of all of the above of why we're not testing as many people as we could be. And I think the idea that not as many people need tests that have been in other regions is certainly a plausible one.
Thank you, Matthew. Now to Megan Carpenter from Spectrum News 1. Megan?
Hi, yes, thank you so much for taking my question. This is also a question about PPE. We're hearing that nurses in some hospitals are being given only one N95 mask to use for an entire day. Can you just give us a sense of whether or not this is happening in a lot of hospitals in the state, and what you're going to be doing to make sure that the busiest hospitals are getting the right amount of PPE that they need?
So, you were sort of cutting in and out, so I think I got your questions. So yes, we have heard from hospitals that that people are reusing PPE, that they are and that there are some hospitals who are exploring technologies to sanitize and clean PPE for reuse, for the same person, but over multiple shifts. I think Dr. Westergaard would probably talk about the science around some of those technologies to sanitize PPE, but we are certainly exploring ways to reuse, to extend the life of, to sanitize, to do things that would increase essentially the supply of PPE. It's not ideal. It's not best practice. It's not standard of care, but we do have a shortage of PPE here in Wisconsin and around the nation, and we're competing with each other for those very limited supplies. And so while we continue to press on our opportunities to buy more, to receive more donations, we are also pursuing the kinds of strategies to prolong the use of PPE that we do have as a last resort.
Yeah, I would agree. I know with what the Secretary said earlier about the question was sort of to rank our biggest needs in terms of resources, and it's not even close. PPE is number one, because the virus is so highly transmissible, and what we've learned about asymptomatic transmission. Truly, the standard that we would like to aspire to is universal mask and face shield for all patient care interactions, and we are so far from being able to do that with the supplies that we have. That it's causing problems. So the solutions to that, to try to get at, is prolonged use of a mask during a shift, and that's considered to be an acceptable contingency standard of care, provided that the mask itself doesn't get saturated or soiled, or the healthcare worker doesn't touch it with unsanitized hands. So there's some training that needs to go along with these contingency measures of wearing masks for a longer period of time, and some other things like for the N95 masks, actually sanitizing them. There's some technology approaches using ultraviolet light or aerosolized hydrogen peroxide that can actually sterilize or sanitize the masks so they can be worn for a second day. Like, these aren't the way we want to do things, but that issue, the PPE plays such a critical role in preventing the spread of respiratory droplets that it's really one of our most important lines of defense. So if we could have one wish, I think that would be it, that we would have enough, we would have no shortage at all, and that every healthcare encounter and every long-term care setting, every patient encounter, resident encounter where there's close contact would have masks, gloves, and eye protection. But we've got a long ways to go before we could reach that standard, so we're trying to make do and give people the best advice on how to conserve and prolong the use as best we can.
Thank you, Megan. Now to Jessica Van Egren from Up North News. Jessica?
Hey, my question is for Secretary Palm. I was just hoping that you could explain real quick what is required of the legislature in order for the state to qualify for the additional $150 million per quarter in the Medicaid funding, and if there's a deadline when action would need to be taken for the state to, qualify for that.
Sure. So this is the $150 million you're talking about is an increase in the federal match in our Badger Care Medicaid program, and to access that money, we as a state have to submit a waiver for that money, and under state law, we are required to get permission from the legislature to do that. And so we do need the legislature, and have been talking to them and working with them on this issue to be able to draw down that additional $150 million per quarter to defray costs of increased care and increased enrollment in the Medicaid program here in the state of Wisconsin.
Thank you, Jessica. Now to Will Cushman from WisContext. Will? Will Cushman? And a reminder, *6 to unmute your phones. Will Cushman.
Hi there. Sorry about that. Can you hear me? Thank you for the call. Secretary Kolar mentioned a little while ago how the one donation that veterans' homes in the state are currently accepting are cotton face masks. I'm wondering, I guess this question is for whoever could answer it. I'm wondering if DHS is advising hospitals or medical clinics to also accept such donations, or has any guidance related to those?
Yeah, we do have guidance related to cloth masks on our website now since earlier in this week, and consistent with what the CDC also weighed in on earlier is to allow and encourage their use outside of the healthcare encounters that I talked about before. So as the general public or individuals in congregate settings can feel comfortable wearing those as one piece of an infection control measure in combination with hand hygiene, environmental sanitation. So whether there's a similar role for cloth face coverings in hospital settings for people that don't have patient contact is certainly consistent with the recommendations that we've used. So general public as an extension of respiratory etiquette and in combination with hand hygiene and environmental sanitation, cloth face coverings are totally appropriate.
Thank you, Will. Now to Sean Kirkby from Wisconsin Health News. Sean? Sean Kirkby.
Hi, thanks for taking question. I was wondering in regards to the State Fair Park Exposition Center, are you planning to stand up any other, or are you standing up any other surge facilities in the state, and if so, where? What's the needed capacity for beds do you anticipate? Thank you.
So we certainly are in conversations with local jurisdictions as they think regionally and locally about their surge capacity and their planning. Milwaukee and that community are a little bit further along, and I think have done some really important and good work in this space. And some of that is because they are seeing the largest increase in the biggest number of COVID-19 cases, and so are certainly feeling more urgent around needing to have surge capacity to handle a potential surge in cases in that community. But Dane County also is in conversations. Their healthcare leadership, their county emergency management, and their local elected leadership are currently in conversations about what and if and how many they might need in terms of their own alternate care facility. We are obviously participating in those conversations, but I think it's obviously very important for local and regional leadership to assess their capacity, assess their need, and make some decisions together about meeting their potential surge capacity in partnership with us. And so we'll continue to have those conversations, whether it's Dane or other parts of the state, as they do that work together as well.
Thank you, Sean. Now to Bram Sable-Smith from Wisconsin Watch. Bram?
Yeah, hi. Thanks for taking my call, and as always, thank you for keeping this line of communication open. My question is about PPE as well. Everybody needs it right now, from the hospital workers in the cities and out to EMS providers in rural parts of the state. So I'm wondering how much of what the state has requested from the national stockpile have we actually received, and then how are you prioritizing where that protective equipment gets distributed?
Yeah, so there are a couple of moving parts here. One is the federal strategic national stockpile, which is available to healthcare organizations and frontline healthcare workers. And then there are requests we have made to FEMA and the donation, buyback, and procurement work that we are doing. And so we have received 2 of our 3 shipments from the Strategic National Stockpile. We are expecting our 3rd and final one, and will be pushing that out to local communities, as soon as we can, as soon as we get it, as soon as we can package it up and push it out. But those SNS, Strategic National Stockpile, stop using the acronyms. Those are particularly for healthcare, and then we have distributed through the buyback and PPE program that the governor established resources specifically to first responders, public safety, and that includes 15,195 respirators, 24,200 surgical masks, 2,047 coveralls, and 33,600 pairs of gloves, and we will continue to press FEMA to press on our own procurement and buyback provisions to continue to get as much access as we can to this very critical piece of our response to COVID-19.
Thank you. Now to Eric Gunn from Wisconsin Examiner. Eric?
Thank you for taking my question. Excuse me. When the time comes that Safer at Home is lifted, there's growing interest both in the state and nationally to push for much more widespread testing, following the example of countries like South Korea that would be part of that and make it possible to open up more safely. Is much more widespread testing something the state is able to pursue? And is that something that you're looking at trying to develop in anticipation of that?
So I'll let Dr. Westergaard chime in here, but right, when we think about the work that we're doing while we're flattening the curve, about those strike teams, those task forces, the priority work that we have been doing, in the background, while we've all been working together to flatten the curve, includes expanding our testing capacity. And you've seen us doing that over the past several weeks, and we will continue to do that and monitor the supply chain closely, because that continues to potentially be a rate limiting factor. But as more technologies come online, as more kinds of tests come online, we do want and we do really believe that it is an important tool as we are going to have to actively manage this virus until there's a vaccine or effective medical treatment. And so testing and more widespread access to testing, this contact tracing and those nuts and bolts public health tools are really important ways that we will be able to do less restrictive measures around, as it relates to Safer at Home, because we will have these capacities to really be focused on where we see a positive case, where those contacts have been, how we wrap around that are those really important tools like testing and contact tracing. So we definitely want to continue to expand our testing capacity and our ability to smartly, strategically, and in a larger scale do testing as part of our active management of this outbreak. Do you want to say more about
absolutely. No, widespread testing is critically important, and I think we have a good path there. The limitation right now is manufacturing, because we'll be at a position where we can have rapid turnaround tests for COVID-19 in all healthcare settings. The technology is out there. Their FDA is approving under emergency use authorization tests that can test for COVID-19 using platforms that are already in a lot of clinical labs. But the demand is going to be so extraordinary that it's going to take probably weeks or months before the supply of those things can really allow widespread testing. So there's some things there that we can't rush. The things that we have been doing actively are building the capacity in our larger labs, like the state lab and the other reference labs. But those are still ones that sort of need to have a specimen shipped from one location to another, so the turnaround time is not going to be great. What we really need is for these ubiquitous platforms that are using get a sample, get the result in the same encounter or the same day, those need to scale up massively. And the infrastructure is in place to do that. It's going to take some time to build those things up. But the other point I'd really emphasize that is that, yes, widespread testing is important, because without it we don't have visibility on where the infection is. But it's not sufficient. Just testing is not an infection control strategy. Testing tells us where the infection is, but then we have to do all the things we're talking about. We have to really zero in on when we identify a test, what services can we do to keep the person safe at home, isolated, out of contact, keep healthcare workers safe. Like, all of those things are necessary if the testing is going to allow us to do anything good on controlling the epidemic. So it's been easy to sort of blame not having enough testing, because it's easy to understand why that's a problem. But having enough tests doesn't get us where we need to be. We have to do local public health infrastructure. We need massive investments in local communities and their health departments to be able to do the contact tracing in a sustainable way, because until we get a vaccine, we're going to be having to do this. We're going to be having to do contact tracing and community outreach and going to people's homes and making sure that healthcare facilities have PPE. We're going to be having to do this for a long time, frankly. It might be a year or more, or 2 years before we've have the tools in place to eradicate or stamp out the infection altogether. So those things, and I think, I'm really encouraged to hear that there's potentially some investment in the legislative package about investing in local public health, because that's clearly what's needed. Like, we have to do this at local public health. Otherwise, we can have all the tests in the world, and we're not going to do anything good with them unless we can do contact tracing and isolation and quarantine. That's really how you stop an epidemic. And we need to, we'll get there, but we need to really build the public health infrastructure in a way that we never have before.
Okay, thank you. Now to Stephanie Hoff from WisPolitics. Stephanie from WisPolitics. And a reminder, *6 to unmute your phone. Stephanie Hoff from WisPolitics. Okay, then our final question today comes from Adam Brewster from CBS. Adam Brewster from CBS. Okay.
Hello.
Hi, who's there?
Hi, this is Stephanie Hoff from WisPolitics. I'm sorry about that. So my question is for Governor Tony Evers. The Department of Workforce Development recently projected Wisconsin's unemployment rate to be almost 27% for the month of March. What is your response to that?
Well, the response is that our situation in this state is not unlike the rest of the country, for starters. And this is a direct result of our fight with a virus and our ability to contain that virus, so that we don't have 50% unemployment rate. So the question is, from you, is something that, yes, we have to make sure that unemployment insurance is there for people. We have to make sure that we work with the legislature to find that one, make sure that people can get it right away instead of having to wait a week, and we can get that done. But at the end of the day, that unemployment rate is obviously not what we want. But the way we solve that is to take on this public health emergency in the most proactive way as possible, so that we can get to the point where we can bring people's jobs back and to where we existed before this pandemic. But you just heard Dr. Westergaard talk about the fact that in order for us to continue to win this war against this virus, regardless of what stage we are at reopening, we have to have a public health system in the future that doesn't look like what it is today, and that is investing in the local public health and the state public health, so that we have the testing, so that we can use the testing results to find out how that happens so that we can restrain any further outbreak and go back to 20% unemployment. Those things are all connected, and we can get there, and we will get there as a state of Wisconsin. I feel very confident of that.
Stephanie, thank you.
CBS. Is it possible to ask my question? Thank you. Just a quick question, possibly for Secretary Palm. Just one, do you have any reports of anyone who voted or worked a poll yet who has tested positive? And as you monitor that situation over the next several weeks, is there guidance for health officials to, when someone goes in for a test or tests positive, ask if they participated in Tuesday's election, whether in-person voting or as an election worker?
So I'm not aware of any reports so far of folks who are showing symptoms or have sought medical attention linked to in-person voting on Tuesday. There certainly are protocols and guidance that we have given, and as it relates to mass gatherings, as it relates to doing contact tracing, and so I don't think it's different for this as it is for other contact tracing interviews. But if you want to speak specifically to that kind of guidance, Dr. Westergaard.
No, I think as we've mentioned before, every case is entitled to and should have a detailed interview on with whom and what environments have been exposed to, and so that would be covered by the standard contact investigation, whether they've been at the poll.
Thank you, Adam. And that concludes today's media briefing. Please continue to monitor the DHS outbreaks and investigations and COVID-19 web pages for information about data and guidance. And for topics not related to public health, you can visit the websites of the Governor, Wisconsin Emergency Management, the Department of Workforce Development, Department of Veterans Affairs, and Wisconsin Economic Development Corporation. Thank you, and have a good weekend.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.